So, welcome everyone. Thank you very much for joining us this evening. I'm Robert Johansson, Chair of the Australian Friends of Asha. We're a group that's now for over 10 years been working to raise money and support the work of Dr. Kiran Martin and her team at Asha working in the slums of Delhi. Welcome especially to groups I know who are dialing in this evening from Cause, the solicitors, from Macquarie Bank, from the Australia-India Institute, and from the University of Melbourne. All those organisations have been great supporters of us and of Asha over many years. I know some of you will be joining us for the first time. So thank you very much for joining. I should say too that if you want, there's a live transcript available of this as we're going. All you need to do is click on live transcript on the bottom of your screen. For those of you, I know some of you are new and some of you will be not familiar with Asha. Asha was founded over 30 years ago when a young paediatrician turned up in a slum in Delhi to deal with a cholera outbreak. And she never really left. Asha now works in over 100 different slum communities in Delhi and where over 700,000 people live. Dr. Martin and her team have had extraordinary success in improving maternal health, childhood survival rates, a health project turned into a community building project, and now children go to school and even to university. As I think we're all well aware, the impact of COVID on these communities, on these fragile communities, where a lot of people live hand to mouth with chronic health issues, has been devastating. I'm sure everyone's been watching the reports on the television and on news items and reading stories about this. From where we sit, it looks horrendous. This afternoon, we get the opportunity to hear firsthand as to what's happening there. I should say this, I don't think, is just a story of dystopian despair. It's more about people within their own communities, led by extraordinary individuals, particularly young people, taking responsibility for themselves, their circumstances, and their neighbours. But they need help to deliver even basic levels of care and help. Many of you who have dialed in, I know, have been already extraordinarily generous in supporting us. But we do hope more of you will be able to donate using the online facility, which you will see on the screen. Every dollar you give us will be sent to Delhi. Our small operating costs we cover from other sources. So thank you all again very much for joining. First, I'd like to welcome the Australian High Commissioner to India, the Honourable Barry O'Farrell. The High Commission has been a great supporter of Asha now for many, many years. It's provided financial support, but even more, it's provided internships and connections with people. So we'll hear from the High Commissioner about his perspective as to what's going on there. And then after the High Commissioner, we'll hear from Dr. Martin about what is actually going on in the streets and the laneways of the slums and about the work that's going on. So thank you very much, High Commissioner. Over to you.
Apologies, Robert, I just had to find the unmute switch. And from my end, it looks as though my video is not on, which means everybody's getting to see the best possible view of me. But it's a pleasure to be with you again and for organising this virtual meeting of Friends of Asha from both Australia and India. And I have to say, when I was reflecting last night about today, it seems almost like a lifetime ago when on the 3rd of March, we last assembled online to inaugurate the IT centre that your generous donations have made possible. And so I start by hoping that you're all doing well, particularly our friends and partners in India who have been going through very difficult times. Robert, as you've just reflected, given the unimaginable anxiety, anguish and grief this second COVID wave has visited upon India, it takes a lot of courage and determination to stand up to your friends, family and community as a warrior and provide much needed and timely support. And we respect and value your commitment as an organisation and your resolution and efforts in combating this latest COVID wave. And I'm delighted that Australia stands with India in this hour of crisis. Here at the Commission and across our posts in India, we've been closely monitoring the situation and working with the Indian government, as well as voluntary organisations like Asha in India, in identifying the needs and trying to provide the emergency aid and relief materials. 10 days ago, the first emergency medical supplies from Australia were flown into Delhi by a government-chartered Qantas flight. This time last week, this last Monday, we were advised that these supplies had already been delivered to state health authorities in Assam, Bihar, Jharkhand, Orissa, and West Bengal for use in their areas of need. A second plane load arrived last Friday, and another is due this coming Saturday. And when this arrives, more than 3,000 non-invasive ventilators and over 100 oxygen concentrators, plus all the necessary consumables, will have been provided to assist in this effort. The Australian government is also working closely with state and territory governments, and importantly, the private sector, on further emergency supplies for India. Here in India, the government often talks about the world as one family. And at this time, the global response to India's latest COVID wave has demonstrated the truth of that view. As you've said, the Australian High Commission in New Delhi is also using resources available under our Development Assistance Program to support COVID response projects on top of those projects supported by our consulates in Chennai, Kolkata, and Mumbai. After a 10-year partnership and too many High Commissioners, the Australian High Commission certainly values Asha, a partner which makes a substantial contribution towards vocational education, health, and youth empowerment in some of the poorest communities here in Delhi. Asha particularly supports young people who make their country and their families proud. And we here at the High Commission are particularly proud too of the role we've played in supporting the Asha internship program since its inception in 2012. And it is a fantastic opportunity for students to gain experience in the workplace, develop professional and communication skills, and build confidence. And since my arrival last February 4 months ago, I've had the opportunity to meet some of the extraordinary people that have gone through that program and who are now happily doing well, supporting their family and also giving back to the community as so many Indians do. And we look forward to the resumption of those internships here at the High Commission once the COVID situation eases. It's been obvious to me in my time here that it's Asha's strong values, commitment and well-established network of frontline workers which are the key ingredients to your success in connecting with the community and successfully implementing practical solutions aimed at so many of the economic and social challenges faced by so many. So today, the High Commission again wants to practically demonstrate that we're with you in your efforts to fight this vicious second wave with an $11,000 donation from our 2021 direct aid program. And I want to conclude by again thanking and congratulating all members of the Australian Friends of Asha and those from other parts of the world who I know all do much hard work in continuing to raise generations to support what in my lifetime is one of the most wonderful and focused organisations I've ever come across. So please stay safe, stay well. Please keep in touch with my team And if we can continue, so that we can try and continue to identify areas where we can work together in coming years. Thanks very much.
Thank you so much, High Commissioner, for your words of encouragement. And thank you to every one of you who's here today and to get an update on what's happening in the slums of Delhi. The High Commission has always stood with us through thick and thin. And, during the first wave, there were so many problems that the slum dwellers were facing. And sure enough, the High Commissioner, as well as the entire family at the High Commission, stood with us in a variety of ways. And together we were able to fight it. And once again, when we thought it was all over, we are in the middle of something even more horrendous. And you have stood with us again. And, it is just such a wonderful friendship. You may have heard that there are about 350,000 cases that get identified every 24 hours. Those are the official figures in India, but I mean, I can say for sure that the figures are much higher than that. And also Delhi's figures are now showing at 8,000, but those are highly inaccurate because there are no RT-PCR tests easily available. And even in the slums that I'm working in, mostly people who get mild fever and COVID symptoms don't even get tested. They can't get tested even if they want to because of constraints in labs. And there's so many deaths. I mean, the figures, this past 21 days have been so devastating. And, they say in Delhi that, there have been about 8,000 deaths, but I'm sure that from the crematoria records, it's much higher. It's about 15,000 deaths or so, or even more. So here we are with a situation where there is no bed in any hospital, and we're talking of public hospitals. And the oxygen shortages continue. It's so bad because when a patient does get in, the oxygen pressures keep going up and down, and there are hardly any staff members. So many doctors have died. So many doctors' parents have died. So there's a very scanty staff in the wards. And so if a patient's oxygen mask falls off or something, there's nobody. They can keep screaming, and there would be no one to come and replace it. They might be found collapsed, lying in the bathroom. So everyone is scared. And, when you see all these images, if a slum dweller sees them, you can imagine how frightened they get. When it comes to the slums, as you may imagine, they're just living cheek by jowl. There's no possibility of social distancing because they all live basically in one room. And then you have a public toilet block. And so they don't have their individual toilets, so you can spread COVID there. And then when there's water that comes at a certain time of the day, people, and just there's large crowds of people that go and try and fill up their cans and buckets. There's so many points in the life of slum families where there's large crowds and where they can easily contract the disease. There's a lot of stigma associated with COVID in the slums. I've known of families that have been forced to leave the slum. There's also been families that will just hide inside with COVID symptoms but not come out and say that something's wrong with them and then they need help, and then they sometimes come out when it's terrible, and they become very seriously ill, and then they require hospitalization. So these are just some of the challenges I mentioned. There's a lot more, but I just thought I'd talk to you a little bit about what we're trying to do. And so with Asha's interventions, we have formed a team, and the team is made up of doctors, nurses, healthcare workers, and like the Honorable High Commissioner mentioned, Asha Corona warriors. And these are students that we have supported all through high school and university. Many of you have supported them, in fact. And these students have come forward much against the wishes of their parents often, or peers or neighbors, and they have demonstrated great courage and great bravery and said, we're not going to run away from, we're not going to shy away, we're not going to run away, and we're going to make sure that we provide leadership and look after people who are sick in our communities, as well as spread awareness. And so this entire team, which is made up of hundreds of people, goes out to every single slum that Asha works in. And there's a whole variety of interventions that we make. The first and most important thing, of course, is to identify patients. And that's, again, a huge issue because of the stigma. But the warriors, they go out along with the team, they knock on every door, try to find all the patients, and try to alleviate their fears and anxieties and say that they can look after them. Then, of course, the team triages them. And as you all know, for mild patients, you just need a little bit of medication and rest and supportive treatment. But the whole the point is that these patients have to be very strictly monitored, so that if they go into severity, then it must be arrested immediately, so that they don't then require hospitalized care. And so we have formed all these protocols, and the warriors are so good that as soon as there's a patient who gets breathless, they literally come to know immediately, and they come running to the center and they tell the health staff that, listen, there's this patient who's got COVID for the past, say, 8 or 9 days, is breathless. And so then we would immediately look at the patient. And what we've done is, because there are no hospital beds and there is such a huge problem with oxygen, we treat even really sick patients in their homes, and we've been really successful. So essentially, if they need intravenous fluids, we give them fluids at home. If they need oxygen, we've got oxygen concentrators, and this is because the Friends of Asha in Great Britain, they were absolutely amazing. At a time when there was no oxygen at all, they were able to send us oxygen concentrators from the United Kingdom. So we then provide them with oxygen in their homes, and they might require high-dose steroids, either orally or intravenously. They might require antibiotics if they've developed a secondary infection. They will require to be hydrated. They need anticoagulants, as you may have heard, because this is the disease where there's a clotting that occurs in the vessels. So we have got the entire army of therapeutics and drugs that we require to treat these patients. There are so many of them. There are hundreds. Everywhere you look, you'll find patients with all COVID-like symptoms. But the good news is that if you intervene in good time, you can save lives. And so that is why I just wanted to stress, that we just need to have all the resources that we require to be able to save lives. And if we are quick on our feet, and if our warriors are really alert and are able to bring patients to us at the right time, or if our team finds them, then we have the wherewithal to be able to go in and treat them. Obviously, there's a lot of risk involved, as you can imagine. With the warriors, of course, they wear their PPE, and we are very careful about all that. But still, you have to go inside the patient's home if you have to, use a pulse oximeter or take their blood pressure or whatever. And in most hospitals, they just see patients from a distance only because they're really scared that they might get COVID. So with all of these ways, we are actually being very successful. And there's every day I get sick patients. Like every day there are severely ill patients we keep getting in all the different slums. We literally have oxygen everywhere, and we have vehicles on standby. And the moment a patient falls really sick, our vehicle rushes to that place and then tries to give them treatment at home. And so with all these methods, we are saving lives. And of course, without that, you can imagine that all these patients whom I'm talking about who required all this treatment would have died for sure. Or if they managed to get into a hospital, they might. Only 1 or 2 out of 10 patients who get admitted in a public hospital get discharged. I just want to talk a little bit about what we're doing for prophylaxis before I show you some slides. Someone is going to just bring up some slides in a minute. But I just wanted to talk about the prophylaxis, and that is that, warriors. Now, this is a very huge population. We are talking about 700,000 that we immediately are looking after, and then there's 1 million in all, because we're going to so many other slums where nobody is going at all, because all you can see is Asha workers. You don't see anybody else there. And so we have been able to, through our warriors distribution, we are distributing masks everywhere to everyone. We are giving vitamin D3 because that has been known to be directly correlated with COVID. And we are also giving them all important critical health messages. And of course, the other thing is that there's a lot of hunger and starvation in the slums at this time, because this is the 4th week of the lockdown and people haven't gone to work. And so they're desperate to be able to get work, and there is nothing. So, we've already started giving out grocery parcels to really needy people, as well as to those who are infirm and those who have no way of earning. And this whole emphasis on continuing to give relief for those who are starving, for destitute families, is going to it's going to happen in a big way this week, because the lockdown has again been extended, and we think that this month definitely it's not going to open. We have no idea what's going to happen in June either. So let me just see if those slides can come up. Okay, so they'll just keep rolling while I talk, but this is these slides just basically show you what is going on outside the hospitals, as well as in the communities that we're working in. So with regards to prevention of spread, like I said, we are doing lots of different things. Some of the other things we're doing, for example, is to separate out the toilets in the public toilet block, for COVID patients, because again, it becomes a big problem of spread if you don't do that. And then vaccinations. Coming to vaccinations, there's a huge shortage of vaccinations. You may have heard, everywhere you go, you're told that they're out of stock and they aren't available. And so that's a big problem. So, but I'm just happy to tell you that the Asha team and the warriors have all got vaccinated, and it has come down to having a relationship with the health authorities. We've been successful in vaccinating a part of our population, but it's going to take a long time. Just try to imagine, like, out of the 1.4 billion Indians, even if we say 900 million people need the vaccine, we are talking of 1800 million doses. And 1800 million doses, I don't see it happening anytime soon. So it's going to be a long time before India gets vaccinated, I think. And then, of course, you have the Friends of Asha in different parts of the world that I thought I wanted to talk about. Because without the help of all these Friends of Asha in different parts of the world, we could have never been doing what we're doing. You have Friends of Asha in Great Britain, and they were able to rush concentrators to us at a time when concentrators were being sold here in the black market. I mean, a concentrator that cost 50,000 was being sold for 1.5 lakhs, and even medication and even nebulization, it was so hard to get. So our Friends of Asha Great Britain folks have been amazing, as have been Friends of Asha in USA, in Ireland, and of course yourselves. That is an oxygen concentrator that you just saw on the screen, and we are so blessed that we have that. So such things can save lives immediately. I mean, it's like instant, So I just want to say in the end that I'm so pleased to be speaking to friends all over Australia. I remember that I was there a year ago in March of 2020, and I had to rush back to India because that was the time when India was just about to get locked down. And now 1 year later, we are here, and many of you have asked me what you can do to help. And this is a really my heartfelt appeal to you, to every one of you who's watching and who also might be able to spread the word to help us during this hour of great need that our slum dwellers are facing, both in terms of being able to treat patients, being able to provide important critical health messages to help the prevention of spread in the different slums all over. We must stop this wildfire from raging all through the slums, and we must help those who are so poor that they can't afford food and they have nothing to cook and nothing to eat. And so on behalf of these 700,000 people, I appeal to you to give us this help. We don't know how long this pandemic is going to last, but I feel sure that in the meanwhile, all of you will open your hearts and will stand with us to help. And we are quite sure that if we do not have the ability to stand with these brothers and sisters of ours who've been in the slums and whom we've stood with for so many years, the past 30 years and over, that we will lose many of them and they are going to die if we don't take care of them. So with that, I just give you my heartfelt thanks for your support and ask that you will consider doing your very best to stand alongside the people living in the slums of Delhi. Thank you so much.
Thank you. Thank you very much, Kiran. So you can see what the need is. The Asha team, we need to support those young people going through the streets of the slums to provide the only care that they're getting to those people, and people of all ages. And as you say, Kiran, this is going to go on for a long time. With the current lockdown being extended, there's no real prospect of this current situation getting less intense for some time. But we need money to buy masks and protective equipment for those young people going through the streets. We need money for the oxygen concentrators. We need money for vaccines and other drugs. And we need money for food. Thank you very much, High Commissioner. Thank you in particular for your continued great support and the donation that you've just announced, the $11,000. It's come from the High Commission. These amounts that don't really sound all that much from our perspective do matter hugely and can make an enormous difference. Thank you all very much for attending. We only wanted to do this for a short time, but I hope you'll have a sense of indeed the urgency and of the desperation of the situation that's being faced. And Kiran, on all our behalves, can you pass on our greatest good wishes to you and your team, and let them know that we are doing our best to support them. We do wish you all our very best. The place where you can make your donations is on the screen. I hope everyone who's paying attention will take up on that. As I said, many of you have already given money, and we thank you very much. And I think I'll now just bring the session to a close. Thank you very much for attending, and please give generously. Thank you.